I'm thrilled to welcome you to today's special event on entrepreneurship and healthcare innovation.
Let me tell you a story of a startup. This story goes back 150 years ago. A man named Johns Hopkins decided that he was looking to disrupt the education industry here in the United States. We have 150 faculty working in the Hopkins Business of Health Initiative, trying to figure out innovative ways to do everything from operations to the economic structure around the health ecosystem.
We're fortunate to have an exceptional group of innovators and change makers with us.
Do you know what your passion is? One thing that I think a lot of people do, the minute they get in the door at a career, they kind of stop external learning. External learning to me is in your spare time, when you're not at work, you're developing your craft even further. Do you love it so much that this external learning feels like fun? Life is a use it or lose it proposition.
Healthcare has been the easiest industry ever to disrupt because it's just be transparent and tell the truth. The smartest thing we did, Bill, was publish a price list. Here we are almost 4 years later, and there is not one pharmacy or any organization that publishes a price list of their costs. There's not one.
So if you think about the mission, it's right medicine, right patient, right time, right dose, affordably. It's a clinically driven organization. Earlier in my clinical career, we discharged a patient with an infection. That patient went home and she came back, 2-year-old. I felt horrible. I asked the mom what happened. Well, I went to the pharmacy and the copay was $200, and I didn't have $200. It was an early lesson that if you don't have affordable medicine, bad things can happen to people. It's one of the many reasons I still do the work today.
Nobody's forcing employers to choose PBMs, right? If employers don't like the contract, why cannot employers force the PBM to do the right thing or change to another PBM?
Well, they're starting to, and that's why I go out and talk to CEOs. But the reality is there's an information asymmetry. So when I go talk to CEOs, I have a list of things that I ask them. Do you control all your claims? Do you get access to all your claims?
What advice would you give to entrepreneurs who want to disrupt this space?
Instead of there just being gravity, there's like 5 different forces that you didn't know existed. A common mistake I see is people think consumers are shoppers. Hopefully they will be one day, but they're not there yet.
I mean, you got to start somewhere. You can't just assume that everybody's going to switch to you, but you've got to find an opportunity where you can introduce the results and people will help.
How do we get better health outcomes? How do we get them at a lower cost? And how do we make it accessible to all?